Hello everyone and welcome to my YouTube channel Dr. Invite. Today we will discuss MCQs on the diabetes related to subject physiology and biochemistry. This is our first part and we will continue this series of diabetes related to different subjects like pharmacology, pathology and etc. So here we begin. Question number 1. Which of the following confirmed values meet the diagnostic threshold for the diabetes? Fasting blood glucose less than 140, random glucose more than 160, 2 hours postprandial glucose more than 126 or fasting blood glucose more than 126. In this the correct option is option number D, that is fasting blood glucose more than 126, because on option number 1 the fasting blood glucose is less than 140, which is not correct as it should be more than 126. Option number B, random glucose is more than 160, that is not correct as it should be only 140 milligram per deciliter. In option number C, 2 hours postprandial blood glucose is more than 126. It is not correct as it should be 140 milligram per deciliter. So here comes the feedback that diabetes can be diagnosed as random blood glucose level that should be more than 11.1 millimole per liter, or fasting blood glucose level should be more than 7.0 millimole per liter. And if we talk about 2 hours postprandial plasma glucose, it should be more than 11.1 millimole per liter. Question number 2. Which of the following statement is correct? Insulin suppresses the activity of glucagon synthase. Insulin mediates the glucose uptake in the brain. Prediabetes is a condition characterized by an increased risk of the future development of type 2 diabetes. Or D. The rise in insulin concentration after the meal ingestion is reduced in type 1 but not in type 2. So the correct option is option number C, that prediabetics is a condition characterized by the increased risk for the future development of type 2 diabetes. In this, the option 1 cannot be correct because insulin does not suppresses the activity of glucagon synthase. And option B, insulin mediates the glucose uptake in the brain. That's not correct. Insulin only mediates the glucose uptake in the muscles, not in the brain. And option D, the rise in the insulin concentration after the meal ingestion is reduced in type 1 but not in type 2. That's not correct. So here is the correct explanation, that prediabetes includes the individual with the impaired fasting glucose, that is IFG, and an impaired glucose tolerance, and this condition is associated with the increased risk to the development of the diabetes, the metabolic syndrome, and the cardiovascular diseases. Therefore, the individual with the prediabetes are target of the preventive measure based on the lifestyle changes. Next question. According to the recommendations for the nutritional management of a patient with the diabetes, the consumption of the saturated fat should be less than 10% of the total daily energy, less than 12%, less than 15, or less than 16. So the correct option is option A, that is less than 10% of total daily energy. Option A is correct because a high intake of saturated fat associates with the increase in the LDL cholesterol, blood pressure, and insulin resistance, and these effects are highly undesirable in diabetic patients, because if we have a high intake of saturated fat, it will increase our LDL cholesterol level, it will increase the blood pressure, and it will increase the insulin resistance also, and that all are the undesirable risk factors for the diabetic patient, and this will lead to the higher cardiovascular risk also. Next question. According to the trials on the diabetes prevention, high risk individual can reduce their risk to develop diabetes by doing the following: A. Eating a very low carbohydrate diet, consuming a diet high in monounsaturated fats, losing 5 to 7% body fat through a hypocaloric low fat diet and 30 minutes of daily activity, or initiating a metformin 850 mg and practicing daily vigorous exercise. So in this, the correct option is option number C, that losing a 5 to 7% of the body fat through a hypocaloric low diet and 30 minutes of daily activity. There are certain interventions trials in some countries like USA and Finland, in which we have clearly seen that any changes in the lifestyle, including the moderate weight reduction together with an increased physical activity or reduction in intake of the saturated fats and an increase in the consumption of dietary fibers, is able to reduce the incidence of diabetes around 60% of the risk. Next question. Which of the following are the recommended blood pressure and lipid goals for the prevention of cardiovascular disease in the adults? with diabetes. So option number D is correct, that blood pressure should be less than 130 by 80 and the LDL level should be less than 100. And if we talk about the reason, that is the increased cardiovascular risk of the diabetic patient is due to that the hyperglycemic condition together with the other cardiovascular risk factor such as excessive weight, insulin resistance, hypertension and lipid abnormalities, and thus it is necessary to act not only on a blood glucose control but also on the other risks to reach the best goal. Insulin deficiency is associated with reduced lipolysis, increased ketogenesis, reduced gluconeogenesis, or reduced proteolysis. In this, the correct option is increased ketogenesis because insulin deficiency is associated with a starvation or fasting condition. In this, there is beta oxidation of the fatty acid in the liver, which leads to the production of acetyl coenzyme A, which goes into three steps. First, that is TCA cycle. Second, that is ketone body formation. And third, that is gluconeogenesis. So in option C, it is written reduce gluconeogenesis. That is not correct. So there is ketone body formation. So the option number B is correct. That is increased ketogenesis, because with the deficiency of insulin, there is beta oxidation of the fatty acid, which will lead to the ketone body formation. So the correct explanation is absolute insulin deficiency leads to the accelerated lipolysis in the adipose tissue with the increased flux of free fatty acid to the liver. Normally, in the liver, fatty acid undergoes the beta oxidation to acetyl coenzyme A, which totally oxidized in the Krebs cycles in an insulin deficient state, and the capacity of the liver to oxidize all the acetyl coenzyme is exceeded and ketone bodies are formed. Next question, the risk factor for the type 2 diabetes mellitus. The risk factor for the type 2 diabetes mellitus includes family history, being overweight, high risk of dietary fat, or all of the options. So in this, the option number D is correct, because family history do matters in this, being overweight do matters, and high risk of the dietary fats includes. So in this, all the options are correct. So both genetic and acquired factors contribute to the pathogenesis of the type 2 diabetes, and among this, the overnutrition with a high intake of saturated fats and sedimentary lifestyle play a major role, since they are able to impair the insulin secretion and do worsen the insulin resistance. Next question, the pathogenesis of the hyperglycemia in type 2 diabetes includes all of the following mechanisms except. So in this, hyperglycemia means the high blood sugar level in the blood, and in the type 2 diabetes, so option number 1, increased glucose production by the liver. Yes, this is true that there is increased production of the glucose. Number 2, impaired insulin secretion. That's also true that there is an impaired insulin secretion. Third, decreased glucose uptake from the skeletal muscle. That is true, because if there is impaired insulin secretion, so insulin cannot help the glucose to be absorbed by the muscles. So the correct option is option number D. Explanation is that plasma concentrations and acting of the GLP-1 and GIP are reduced in the patients with the type 2 diabetes. Consequently, the potentiating effects of these hormones on insulin secretion is reduced, and this alteration is termed as reduced incretin effect. Next question, the test for checking the mean plasma glucose concentration over the previous 8 to 10 weeks is, it means that from the last 8 to 10 weeks we have to calculate the mean value for the plasma glucose concentration. So which of the test is recommended, that is hemoglobin A1C or the oral glucose tolerance test or the fructosamine test or fasting plasma glucose concentration. In this, the correct option is hemoglobin A1C, because hemoglobin A1C expresses the amount of hemoglobin that is combined with the glucose, and the highest of the blood glucose, the highest the amount of the hemoglobin. That means higher the level of blood glucose, there will be higher the level of hemoglobin, that is glycosylated. HbA1c reflects the mean glucose over the previous 8 to 10. Next question. Which statement best describes the difference between the characteristics of type 1 and type 2? First, the person with type 2 diabetes usually require low doses of insulin than the person with the diabetes because they have a milder form of diabetes. Or option number B, person with diabetes 1 rapidly develops chronic complication. Option number C, autoimmune factors are involved in the pathogenesis of type 1 but not type 2 diabetes. Or option number 4, the person with type 1 diabetes can increase endogenous insulin production by taking oral hypoglycemic agent. In this, the correct option is option number C, as autoimmune factors are involved in the pathogenesis of type 1 diabetes but not in type 2 diabetes, as type 1 diabetes is associated with the autoimmune factors. Correct explanation is in type 1 diabetes, immunological factors causes the destruction of the beta cells which leads to the absolute insulin deficiency, and in fact autoantibodies against the beta cell antigens are present in the blood of the most patients with the type 1 diabetes. In contrast, no immunological activation is present in type 2 diabetes. Next question is, which of the following is not a beneficial effect of the exercise in people with diabetes? That is not a beneficial effect. That is reduced triglycerides, hypoglycemia, increase of insulin sensitivity, help controlling the hypertension. Correct option is hypoglycemia, that is low blood sugar level. Correct explanation is diabetic individuals treated with insulin are at high risk of development of hypoglycemia because sometimes when a patient is treated with the insulin, there is instant low blood glucose level, and during the physical exercise due to mainly increased glucose uptake in the skeletal muscle. To prevent this complication, patients should consume a snack of 30 to 40 grams of carbohydrate before and early during the exercise, or reduce the pre-exercise insulin dosage. So that means either the patient should decrease the insulin dose before doing the vigorous exercise, or the patient should consume a snack around 30 to 40 grams of carbohydrate. That will both increase the blood sugar level in our body and that will cooperate with the condition of hypoglycemia. Next question is, in uncontrolled diabetes mellitus, elevated triglyceride and VLDL level are seen due to increased activity of lipoprotein and decreased activity of hormone sensitive lipase. Increased activity of hormone sensitive lipase and decreased activity of lipoprotein lipase, or increase in peripheral LDL receptor, or increased activity of hepatic lipase. Correct option is option number B, because hormone sensitive lipase has an increased activity during this time and there is a decreased lipoprotein lipase activity. Because hormone sensitive lipase is the enzyme responsible for the fatty acid conversion into triglyceride, the correct explanation is that increased activity of the hormone sensitive lipase, activity of the lipoprotein, control the diabetes mellitus, and elevated the triglyceride and WLD levels are seen due to increased activity of hormone sensitive lipid, which insulin inhibits, and decreased activity of lipoprotein lipase, which insulin stimulates. Next question is, what is true about type 1 diabetes mellitus? A. Decreased protein catabolism, decreased hepatic glucose output, increased lipolysis, or increased glucose uptake. Correct option is option number C, that is increased lipolysis. Because in increased lipolysis, uncontrolled insulin dependent diabetes, that is type 1 diabetes, in which because this is insulin dependent diabetes, it involves a decreased glucose utilization with a hyperglycemia, because our body does not use glucose, and this result in the hyperglycemia, that is high blood glucose level in our body, and an increased fatty acid oxidation, And increased fatty acid oxidation leads to the excessive production of acetoacetic and 3-hydroxybutyric acid and 1 of acetone, which are known as ketone bodies, and acetoacetate and 3-hydrobutyric acid are dissociated at the body at pH and release the H, leading to a metabolic acidosis. Next question is glucose transporter effects in diabetic mellitus. So we all know that the GLUT4 always help in the glucose transport, and in the case of diabetes mellitus this GLUT4 is effective. So GLUT4 is responsible for facilitating the transport of the glucose into the cell in response to the insulin, and for this reason the mutation in GLUT4 have been associated with the type 2 diabetes. Next question, what can be prevented by inhibiting the aldose reductase in diabetic mellitus? That what all can be prevented by inhibiting the aldose ducts in the diabetes mellitus: deafness, diabetic neuropathy, diabetic nephropathy, or diabetic or cataract. So diabetic cataract is the correct option, because in diabetic cataract when there is an excessive glucose, example in diabetes, it is converted to sorbitol by aldose reductase. So glucose is converted into sorbitol with the help of aldose reductase, and the sorbitol is responsible for the accumulates in the lenses and causes a diabetic cataract. Amyloidosis is seen in which type of diabetes mellitus? This is A option, maturity onset of diabetes mellitus, type 1, type 2, or all of the above. So the correct option is correct option number C, that is type 2 diabetes mellitus. This is because type 2 diabetes mellitus, the two best examples of localized amyloidosis are, that is Alzheimer's disease and type 2 diabetes mellitus. In type 2 it is the isolate of amyloid polypeptide, also known as amylin. Next question, which of the following is not due to genetic mutation? 1. Diabetes type 2, cystic fibrosis, hemophilia, or alpha 1 antitrypsin deficiency. So the correct option is option A, as we all know that type 2 diabetes is not associated with the genetic mutation. So the correct explanation is that type 2 diabetes is associated with a multifactorial inheritance, and that multifactorial disorder results from the combined action of environmental influence and two or more mutant genes having additive effects. And this multifactorial disorder are cleft lip, cleft palate, coronary heart disease, congenital heart disease, hypertension, diabetes mellitus type 2, gout, pyloric stenosis, or other options. And diabetes insipidus is X-linked recessive disorder due to genetic mutation, but not type 2. Next question. Diabetes mellitus is characterized by hypoglycemia. Hypoglycemia is a condition with a low blood glucose level. So the correct option is false. That diabetes mellitus is not characterized by hypoglycemia. It is characterized by hyperglycemia. Next question. Type 2 diabetes is characterized by insulin resistance, insulin lack, beta cell reduction, beta cell destruction, or none of the above. So it is insulin resistance. Next question. A 35-year-old patient comes to your clinic with a newly diagnosed diabetes, that is newly diagnosed, and the lab test reveals no C-peptide in her blood, and she has lost a lot of weight in spite eating. The patient has adult onset diabetes, GDM type 1 or type 2. So the correct option is option number 1, that is type 1 diabetes, because in this type of diabetes we cannot see any C peptide in blood. Next question, the hormone that is secreted by the alpha cells of the pancreas that raises the blood glucose when the levels are low. That means we have the hormone that is secreted by alpha cells, and it will increase the blood glucose level. That is obviously the option number 1, that is glucagon. Next question, which of the following given below tissues needed the insulin for the glucose entry in the cell? Muscle, liver, kidney tissues, or nervous tissues? The option is muscle, that muscles always need an insulin for the glucose entry into the cells. Next, the renal threshold for the glucose is 180, 120, 200, or 140. The correct option is 180 milligram per deciliter. If blood glucose levels are marginally low before exercise, the diabetic should not exercise that day. The option is false because only if the blood glucose levels are highly low on that day the diabetic should not exercise because of the hypoglycemic condition, and also the patient needs high glucose level for the skeletal muscle to work. Next question. Classic symptoms of type 1 diabetes include polydipsia, polyuria, and polyphagia and weight loss. The correct option is true, that yes, type 1 diabetes include polydipsia, polyuria, polyphagia, and weight loss. Next question. Insulin promotes all but which of the following? Lipolysis, lipogenesis, protein synthesis, and glucose entry in the cell. The correct option is option number 1, lipolysis. Gestational diabetes increase a woman's chance of developing a diabetes later in the life. That is true. That if a woman is having gestational diabetes, it can lead to the future development of the diabetes. Next, the recommended method for the diabetes diagnosis is oral glucose tolerance test, fasting blood glucose, postprandial blood glucose, or none. The option is fasting blood glucose level. That should be more than or equal to 126 milligram per deciliter. Factors that seems to play a role in the development of type 2 diabetes include weight and hereditary, liver disease, enzyme deficiencies, or childhood illness. So we have to think about the type 2 diabetes. The correct option is weight and hereditary. Thank you everyone for watching my video. If you like, do subscribe, like and comment, and stay tuned for the next videos. Thank you.